Good afternoon and welcome to the Prime Minister's Digital Town Hall for Senior Citizens. I'm Naomi Francis. Well, the government has implemented several measures to deal with the novel coronavirus or COVID-19. Now, it particularly affects the vulnerable, which is really the senior citizens aged about 65 and older. And so earlier this week, the government implemented several measures that we're going to talk about today.
The present order is for the next 14 days. We will review, as we have been doing, in about 10 days, but we review at every cabinet meetings, and the cabinet meets sometimes twice weekly now, sometimes even 3 times for the week, to review. What is the objective of the review? The objective of the review is to ensure that the increase in cases are more aligned to the flatter curve, and as we keep that alignment, then we will be better able to determine when we are at a manageable peak and then at a reduction, and then we can start to, in an appropriate way, loosen some of the restrictions that are in place. So it's very difficult to set a timeline as to when we would relax restrictions. It all depends on the number of new cases. And what does that depend on? How people in Jamaica behave. In other words, the relaxation of the measures depend on how well we are faithful to the measures, how well we wash our hands, sanitize. If we have to sneeze or cough, we use the appropriate methods, that is, sneeze in your elbow or in a tissue and dispose of it immediately, and then sanitize or wash your hands. Be careful how you touch surfaces. Sanitize surfaces regularly for persons who are at high risk, the group for which we have kept this town hall, the persons 65 years and over, but we are focused on stay at home for the 75-year-olds and over, that they should, as far as possible, keep out of regular circulation in the population, and maintain social distance in all the functions that we do. That is for everyone.
I think one of the things that our older people need to understand, PM, and it builds on what you said, is whereas older people are not at any increased risk per se, they are at increased risk of severe illness. When we look at the statistics coming out of China, and the graph tells it, the case fatality rate for younger people, which does not minimize severity of illness, is below 1% right up to age 59. When you get to 60 to 69, the case fatality in China, which is the number of people dying, is 5%. When you get to 70 to 79, it is 10%. And when you get into the 80 and over age group, it's 18%. So you are perfectly correct that if our older people get COVID-19, the severity of their illness is going to not only take up hospital beds, but it's going to deprive our families and our communities of an elder person, of that wisdom, of that child care. So it is an important loss to the community in general. Now, the reason for all of this is that if older people come in contact with the virus, and that's the critical point of what you're doing, what the government is doing, what all of us are preaching, they must not come in contact. In the body, the immune system is less efficient than yours. And not only that, the cells in the body are also diminished. So once they get this infection, the likelihood of it ravishing their body is high.
From the OPM, Ask OPM email Prime Minister, Ms. Trudy May asks, should persons who live in households with seniors leave the home for their protection?
That's not what the government is saying. Of course, that is up to you if you want to go to that extreme. But what the government is saying is that you should take extra precaution in ensuring that you have in place measures for the sanitization of your hands and surfaces, that where possible, when you come home from work, you go through with these procedures, that as far as possible, you ensure that your seniors don't have to go outside, and you maintain, as much as you can, social distancing.
I have one specifically for you, Doc. My mom, Miss Jillian Dawkins, asks, my mom is 84 years old. She's a cancer survivor. She has a clinic appointment next week. What does that mean? Can she go? Can't she go?
Absolutely, yes. She can go to her next appointment. What we encourage is dialogue with her healthcare facilities so that she can get there safely in a sterile environment and back home again. So yes, once she maintains dialogue with her hospital team or parish health facility team, she can in fact go to her appointments.
Just to point out that the Ministry of Health has said that they will put in place a scheduling regime.
Absolutely.
To ensure that there are specific times to treat with the appointments that are non-COVID related.
Indeed. Thank you so much, Mr. Prime Minister, for that. Let's get the ministers involved as well, because ministers, the Prime Minister introduced the order yesterday concerning what will happen, especially to our senior citizens. One of the questions we have concerned NIS benefits, and there was another one as well concerning visits to the homes for the indigent. Let me ask Minister Mackenzie to respond to that one first.
Well, it's good to be a part of this very valuable and worthwhile discussion. We have put in restrictions on visits to the infirmaries because our infirmaries, we have 17 such facilities across the country with a population of close to 2,300, with 90% of the residents in these facilities falling in that category that we consider to be vulnerable, that age group that would be prone to the disease once it gets in. So we have put in that restriction, and we are enforcing that restriction because we want to be sure that persons who are accessing the facility do so in an organized fashion. One of the things that we have done also is we're working closely with the Ministry of Health in establishing the kind of screening mechanism, not just for those who are going to be visiting the infirmary, but also for persons who are working in the infirmary. So someone take the bus, has to move amongst other persons, come in. We are saying those days are over. We are providing the necessary equipment. So you come, change clothes, put on your working clothes, you go through a process of sanitization, and then you start to deal with the residents in the infirmary. So we are restricting visits to the facility, and over the next 60 days, we are not accepting any new residents into the facility.
Will there be special provisions for pensioners? What about those with NIS?
The payments coming out of NIS, once you qualify for the pension, of course it is based on a number of factors. Yeah, it's an actuarial fact computation that would have been based on earnings, the contributions at the time. So it is difficult for us at this time to say that we are going to increase the NIS benefits, having regards to the factors that would have gone into the determination of what that payment is. But what we can say is that for persons who receive payments by way of the payment voucher, effective March 30th, all payments for the month of April can be encashed at once. The Ministry of Labour and Social Security is the lead on the National Relief Response Program. And in circumstances like you would have had in 7 Miles, Bull Bay, and even in Clarendon, we take the lead as a ministry in terms of coordinating the relief response. What I will say is that so far as a government, there have been in excess of 2,000 care packages that have been distributed. In terms of sanitation packages, we have distributed in excess of 1,800, water, juices, and in fact, this is a convenient time for us to say thanks to our corporate partners. I'll refer to them as partners for now.
If you have someone who is at home or under your care that is an elderly person who is physically challenged, and you are not able to support that person, then the various local offices of the Ministry of Labour and Social Security and the local offices or officers of the Poor Relief Departments, which is usually centered around the municipal corporations, reach out to them. At this time, they have a duty and they will be empowered to respond. I want to clarify the stay-at-home order. Stay at home is the headline, meaning that's what I want you to hear and know. However, you are allowed to leave your home to conduct what we call the essentials of life. So if you have to get your medicine, if you have to get food at the market, if you have to get water, some people still have to do that, and exercise. You want to do a little walk around your yard, walk down to the end of the street and back, if you can avoid that. Those things are quite fine. What we wouldn't want you to be doing at this time is to be unnecessarily exposing yourself to the public. And there's a reason for that, which we'll get into later, and that is we are now transitioning into a phase of the epidemic which is described as community spread. That means that the virus is now in the community. It's not fenced in clusters, it's generally in the community. So the risk of you getting it is increased, and of course the risk of you dying from it is even greater. So we want you to, as much as possible, follow the order of the government, which is to stay in, but you are allowed to conduct once per day the essentials of life.
I have Melinda who's asking, hello, I have a diabetic amputated mother. That's how she writes it. She needs to go to the clinic 2 times a week to have her wounds dressed. Only means of transport is taxi. With the virus, she's not safe to leave the house. Is there going to be free mobile nurses to go around to help non-mobile elderly persons?
If it is that she needs help with getting to a healthcare facility to be dressed, then she can certainly call the helplines. We have them up and running 24 hours a day to provide that ambulance assistance to get them to the clinic. So I really don't see any reason why she cannot go to her clinics to get her twice weekly dressings. Obviously, when I get back into office, I will speak with the Chief Medical Officer to discuss these sort of variables in the system.
Anyone who is in this age group that has a situation that would lead to distress, now is the time to reach out,
Absolutely.
as you have said, to the Ministry of Health, but you also, the duty lies with the Ministry of Labour and Social Security and the Poor Relief, which ties in to the municipal council. So once you reach out to those agencies, they are all empowered to be able to respond to these specific circumstances.
See trees of green, red roses too.